Before I start speaking on hypothyroidism, I would like to greet you all with good moringa instead of good morning. Good moringa is nothing but the remembrance of two super wonderful medicinal plants, guduchi and moringa. Thyroid is a small gland located on the base of your neck, sometimes described as butterfly shaped. Meanwhile, at the base of the brain sits the pituitary gland, which secretes the thyroid stimulating hormone, that is TSH. Changes to your metabolism, heart function, digestion, energy, appetite, sleep, mood, or even the growth of your hair, skin, and nails can all be caused by hypothyroidism. If you face severe hair fall or premature graying of hair, that can also be associated with hypothyroidism. Some of the warning signs quickly we have a look at. Fatigue, which is a chronic in nature, depression and anxiety, weight gain, it is suddenly weight gain. If you notice that you are gaining weight rapidly, infertility, goiter, includes at the base of the neck, sometimes accompanied by tightness in the throat, coughing and swelling, feeling cold or chilled most of the time, constipation, muscle aches and tenderness, kidney related problems, stiffness and swelling in the joints, trouble breathing. So most of the COVID-19 symptoms like trouble breathing, you have sore throat or coughing, feeling chills and even feeling feverish. These are also associated with your thyroid hormone dysfunction. Thyroid condition known as Hashimoto's thyroiditis is associated with an increased risk for thyroid cancer. This autoimmune disease is also the most common cause of hypothyroidism. Around 1 in 5 cases of thyroid cancer occur in people who had a previous benign thyroid condition. For unclear reasons, thyroid cancers, like almost all diseases of the thyroid, occur about 3 times more often in women than in men. Thyroid cancer can occur at any age, but the risk peaks earlier for women in their 40s and 50s, and for men around 60s and 70s. Most patients with thyroid cancer have the cancer obtained in the thyroid at the time of diagnosis. About 30% will have metastatic cancer, with most having spread of the cancer to the lymph nodes in the neck, and only 1 to 4% having spread of the cancer outside of the neck to other organs such as the lungs and bones. Now let's see how this hypothyroidism can be treated well on time to avoid future complications. To understand that, we'll see potential causes of hypothyroidism first. When someone has Hashimoto's, their own body essentially begins to attack itself by producing antibodies that try to destroy the thyroid gland. Why does this happen? The immune system mistakenly thinks that the thyroid cells are not a part of their body, so it tries to remove them before they can cause damage and illness. So thyroid hormone your body treats as a foreign element and tries to destroy that thyroid hormone, which is very concerning factor. A diet low in nutritional rich foods, especially iodine and selenium, which are trace minerals crucial for thyroid function, increases the risk for hypothyroid disorders. The thyroid gland needs both selenium and iodine to produce adequate levels of thyroid hormones. These nutrients also play other protective roles in the body. For example, severe selenium deficiency increases the incidence of thyroiditis because it stops activity of a very powerful antioxidant known as glutathione, which normally controls inflammation, and fights oxidative stress. Getting on track with a hypothyroidism diet ensures that you get appropriate amounts of selenium and iodine in your diet. Gut inflammation, that is normally we know as leaky gut syndrome, is another responsible cause for hypothyroidism. Although it's not very common, newborns are sometimes born with a dysfunction of the thyroid gland with a genetic condition called congenital hypothyroidism. During pregnancy, one has to take care of their thyroid hormone levels, and hypothyroidism during pregnancy can be very, very dangerous and fatal for newborn infants as well. Specific medications seem to lead frequently to the development of underactive thyroid. The most common of these include drugs that treat cancer. Even chemotherapy and even radiation can be very, very dangerous with respect to the functioning of thyroid hormone. High levels of emotional stress, always stress that I define, that damages your harmony of hormonal function. That is, we have out of 50 different types of hormones, we have 8 crucial hormones which are insulin, glucagon, thyroid, leptin, dopamine, serotonin, melatonin, estrogens, and progesterone. These are the two main important estrogens and progesterones, very vital hormones in women. And these harmony of these hormones is very important, and the stress disturbs this harmony. Exercise is very essential to take care of your stress levels and manage the healthy functioning of your hormones. Research suggests that people who regularly exercise usually get better sleep, deal with stress better, and more often maintain a healthier weight, all of which reduce some of the biggest risk factors and symptoms associated with hypothyroidism. Now let's look at medical nutrition recommendations. Now there are a lot of people approach me with elevated levels of TSH, that is thyroid stimulating hormone, even levels crossing more than 10 or even 15 or even 20. We need to understand the nutritional deficiencies like deficiency of vitamin A, vitamin D3, vitamin C is very important. C is a precursor of collagen. So supplementing collagen or vitamin C helps largely with patients suffering from hypothyroidism. Triphala and Brahmi, as I mentioned, leaky gut syndrome. Triphala corrects and cleanses your gut and colon and boosts your gut function and hence the brain function. And Brahmi also boosts the brain function and gut function. Aerobic exercise may help boost your thyroid hormone levels. In turn, this may help speed up your metabolism as well. Proteins that absorb well will help you largely, like you can have paneer, you can have pulses, dals, lentils, eggs, cheese. These are beneficial for hypothyroidism patients. Steam hot rice with plenty of vegetables and dal is best food for such patients. Fresh vegetable soup can be also the nourishing, and spiced buttermilk, especially between the meals when you feel hungry. As I mentioned, apart from iodine and selenium, zinc is the essential mineral which needs to be supplemented with patients suffering from hypothyroidism. MCT coconut oil, that is medium chain triglycerides fraction of a coconut oil, which is our super specialty in research known as Amrutadi Thailam, is highly recommended in hypothyroidism as it boosts metabolism, digestion, absorption, and assimilation of nutrients and it also corrects the thyroid hormone function. That is, TSH levels can largely be reduced by consuming MCT coconut oil 10 to 15 ml twice daily with warm water, or MCT can also be consumed along with your fresh vegetable soups or a cup of coffee. MCT coconut oil can be added over your poha or upma. 1 teaspoon of coconut oil, which wonderfully boost the taste and sensory characteristics of your breakfast items. Shatavari can be best recommended for women's hormonal balance and also to treat hypothyroidism. Velchi banana, that is a small banana, has got lot of essential nutrients beneficial for hypothyroidism. Avoid millets like jowari, bajri, nachni, and totally stop wheat, pasta, noodles in case of very high levels of TSH. This normally I recommend, which works best. But occasionally one can have. You can restrict them, but occasionally you can have. Now strictly avoid the following: foods that contain gluten, bread, pasta, cereals, alcoholic beverages including beer to be avoided. Smoking to be totally stopped. Soy foods to be avoided like tofu, tempeh, soy milk, etc. to be avoided. Certain fruits like peaches, pears and strawberries to be avoided. One can have avla, which is really a sanjeevani, beneficial for hypothyroidism patients. I am sure this audio can be extremely beneficial for those who are suffering from hypothyroidism, and also to prevent the chronic severe complications of Hashimoto's hypothyroiditis and also the complications of hypothyroidism. Take care. May God bless you all.